I think you can start, if it's fine with you. Nama, Sarah?
Yes.
Yes, okay. So hi everyone, and good evening or good day, wherever you are around the globe. Today is the fifth lecture, part of our series of webinars. And now today we are having IsraAid team that will talk and will discuss the role of the community in fighting the COVID-19 pandemic. And it will be focused on the case study of Greece. I'm mentioning this is a part of a wider collaboration, and now we have an organization that comes straight from the field to show us their experience. I am mentioning the fact that this panel is and this webinar is recorded, so later on you can and you're encouraged to circulate it around your social media. And that's it. And I'd like to present the two speakers. We start from Nama, who is smiling at you just right now. And this is at least what I see on my screen. And Nama, she will start the first part, the first half of the lecture. And after that, Sarah will continue. So I'm reading the quite interesting bio of Nama. Nama is a native Israeli with Chilean citizenship who spent quite a while, I think, the last 10 years, dedicated to development programs in Israel and in Africa. Nama obtained her undergraduate degree in sociology, anthropology, and education, and a master in community development studies, both from the Hebrew University in Jerusalem. Prior to her studies, Nama worked in Uganda, where she founded, together with partners, a local NGO, Little Light, which I'm sure that you've all heard of. The NGO has been operating an informal school and community center in one of the biggest slums in Kampala for out-of-school children ever since 2006. Nama has extensive experience in the field of education, specifically with youth at risk and victimized population, both in the formal and the non-formal education system and in out-of-home care programs. Following her MA studies, Nama was involved in the management of a peace-building program in Sri Lanka, in Sarvodaya, USA project. And since 2013, Nama has been working with IsraAid, initially as Kenya country director, leading operations in Kakuma refugee camp in the fields of water, sanitation, and hygiene, psychological support, relief programs, and capacity building activities. Currently, Nama is Israel's senior director of programs, spending her time between the field and the headquarters in Tel Aviv, opening new operations in emergencies and supervising Israel's programs in 19 countries which Israel has ongoing operations in. I told you it's going to be long. Nama was busy. Nama will start, as I told you, but with your permission, I will also show with you Sarah bio. So Sarah will continue swiftly after Nama will finish her part. About Sarah Danby, in 2018, as part of Sarah's Master's in International Development at the Hebrew University, Sarah completed an internship with IsraAid in northern Greece. After finishing her studies, she returned to the project as program manager before becoming country director in September 2019. Prior to her move into the humanitarian sector, Sarah has spent 12 years working in communication, primarily in healthcare. Within this role, Sarah managed and executed international disease awareness campaigns and patient advocacy programs before moving into the high-tech sector in Israel. Sarah has long been involved in humanitarian projects, working on educational programs in Sri Lanka, El Salvador, and with the refugee community in Tel Aviv. Sarah, in her current role, she is directing Israel's ongoing operations in Greece. Israel currently operates 2 missions in Greece, a school next to Moria camp on Lesbos for Afghan refugee children, and community center in northern Greece close to the city of Saloniki. Both missions are focused on providing education and protection programs for the communities they work in. So this was a bit long, but it's fine with me. I enjoyed reading it. And without further ado, please, Nama, the floor is yours.
Thank you, Einat, and thank you, Sid, and the wide collaboration that set up this series of webinars. Sorry, I'm just preparing the screen. Thank you for the opportunity to speak about a topic that is very close to our hearts at IsraAid, the role of communities in fighting COVID-19 pandemic. And I've said, I think we'll start with a little bit of kind of the comprehensive framework of how we understand the specific situation of that and the challenge that the COVID-19 pandemic brings about, and then we'll shift to the case study that will be presented by Sarah. We'll try to keep time with the limited amount of time that we have, so we'll skim through the two topics, and then we'll hope to open for questions. So very briefly, an overview about who we are and what you do and what we do. As I now started explaining, or whoever of you who don't know, IsraAid, we're an Israeli-based humanitarian aid agency. We work globally, and our mission, as you can see on the screen, is basically to support the most vulnerable population affected by humanitarian crisis. We commonly go into a country, enter countries during some kind of a crisis, an event, an emergency event, start off our programming with the emergency response programming, and then build on that and dive into long-term programming, striving for long-term resilience, sustainable resilience of the communities we work with. So evidently, communities is a key factor in the work that we do in general, regardless of the situation. We don't work in every sector. We work in sectors that we feel that we have a relative advantage and something to contribute with. Our flagship sector is protection, including MHPSS, child protection, SGBV, sexual and gender-based violence, prevention of sexual and gender-based violence, etc. Medical care, water sanitation and hygiene, and education. All of the above are the sectors we work in, both during emergency period, but obviously also when building long-term development sustainable programs. And my bio had a hard time to keep updated, because obviously the countries that we work in shift very quickly. The number changes very quickly. This map represents the countries in which we work for the sake of the COVID-19 response, which very uniquely to any other situation is basically every country IsraAid works in currently globally, 14 countries that we work in globally. And then to that, as you can see, the blue dots are the areas where we have the specific emergency response programs. So very widespread globally between Kenya, Uganda, South Sudan, Mozambique, Vanuatu, and currently we are in the Americas, obviously the Caribbean islands, and currently we added program basically starting in China, when we all thought the COVID-19 is a problem of other parts of the world, and then continuing to respond in Italy, and a small initiative in Israel and in the US. So this is kind of the global perspective of who we are and how we came to speak today. And when I put together this presentation, what was very evident to me is that this is nothing new, right? Working with communities or the role of the engagement of communities in any type of program, not only in emergency responses, is essential. But to an extent, this response, this pandemic reminds us what quality programming is and how essential it is in reaching our goals. So any program, any emergency program we implement basically has three main stages: preparedness, response, and recovery. And commonly what we do, as I said, when we deploy to emergencies, when they strike, the first thing we do is that we deploy emergency teams to kick it off, to get it started, and then to build on that for the long-term programs. And this very core essential issue that is core to how we actually do the emergency program in this particular situation is not existent, which forces us, or forced us from the very beginning to one thing very creatively, obviously, and two, to rely on the social communities, the partners we have on ground, the national staff that we have in all these different countries, for the sake of having any type of response, right? Because not only we couldn't deploy, but also, since this is a global pandemic, in many situations, we had to undeploy our teams, or offer the opportunity for teams who are also affected by the same crisis to go back to their, which even makes this point even more evident. So I'm not gonna describe everything we do, but I do want to take two case studies to explain this point even further. So as we can see in the preparedness response recovery program, we have awareness raising, we have increased hygiene practices, we have medical response, secondary emergency, etc. And when we dive into what it means for this specific pandemic, for example, if we look at the preparedness, then we see that all these types of activities that we're very used to implementing, suddenly the role of the community comes about very strongly. For example, if we're looking at mobilizing networks, if we, for example, now in many countries where we work, even in Israel, this comes about as a question, but with the restriction of movement, if we want to do any type of distribution of hygiene kits, which is a very common practice for emergency preparedness and etc., the ability to move is restricted, and the people who are granted the ability to move are either essential service providers, or volunteers from the community, or other networks from the community that are embedded in the community for the sake of these tasks. Another issue that is interesting to see in this framework that we work in, that there is a lot of overlap between the preparedness and the response, in the sense that we see many countries where they are implementing regulations and activities that are common for the response, in situations when there is not even one case. We've seen Vanuatu, the entire country is under lockdown. There is no one case in the country. Another interesting factor to look at for the sake of this example is that if we're talking about awareness raising for the sake of people to be well informed and to manage the behavior accordingly, if in other situations when we want to do awareness raising towards the prevention of different types of protection issues, etc., commonly what we see is that we have the ability to have this ripple effect. So we start with a group, and maybe there is a change of practices or different actions within a core group, and slowly this awareness grows and the behavior change enhances. In this situation, this ripple effect and the gradual growth that could happen is not relevant, because it's enough for one person or two people to not to follow the prevention or the preparedness in that sense, for the entire effort to go in vain, right? Because the social cohesiveness that has to be part of this specific emergency response or preparedness is embedded in the success of the action. So it's not a matter of one person. Another issue that was very interesting to examine, that we saw when it comes to the restriction of movement or social distancing, we saw some countries applied, even Israel in the very beginning, it was very common to hear, applied this control mechanism when they asked neighbors to be the one informing whether the neighbors or the community itself is following or not following the restriction of movement. Other side of it is situations when the community, there is this social cohesiveness, and the community decides to follow these restrictions. It makes the vulnerable populations much more vulnerable. Therefore, the social responsibility that the different individuals within the community had to take in order to make sure that this response, response or preparedness or action is implemented, was really embedded, like very much dependent on the responsibility that individual within the community take for their own communities. So we can see basically that any type of activity that we want to do in this situation, specifically with the limitation of the movement and the presence of the international commonly deployed staff, is very, very strong. More example we can find for the first responders, for example. The first responders that we see here as part of this emergency management are people that in other situations maybe wouldn't have been considered to be the first responders. The supermarket workers, the police obviously are, the medical teams, all these function, the community emergency teams, which is a function that is very common in the settings where we work. All these functions are part of the community and are the core element for the success. Another factor that is also true for any type of emergencies, and here in particular, is the secondary emergencies that we see. Protection, psychosocial, economic impact, the impact on the education system. And at least in Israel, I cannot even count how many situations, how many text messages I received for different initiatives where people say, hey, this farmer just lost their income because they usually go for the hospitality. Let's see that the community comes together to save the businesses of our friends, our partner, our community members. So basically, as we can see here, no matter what type of emergency preparedness response programming we want to see, the ability to succeed in fighting the direct or the indirect impacts of this pandemic are totally dependent on the community and the community initiative. So for us at IsraAid, what is very key in any type of programming, and more so here, is that in any type of programming, we have to make sure that we develop content with the community in a way that respects and tackles the basic cultural beliefs of the community. We see a lot of fake news and false assumptions about the pandemic, and we have a lot of information sharing sessions. And only, I'm going to the second point, only when we have this ability of the two-sided communication, where people don't only get the chance to hear and learn the actual solid information, but also to engage with it and to interact with it, only then we can tackle this fake, misconceptions about that are in many times could be very harmful. Also important to ensure that we tap onto existing mechanisms, have it be online systems, and not imposing new systems and other stuff, but also the social networks. There is a lot of creativity, there is a lot of initiatives coming about specifically to support and assist in this situation. As I said before, the secondary emergency, the protection issues with the social distances that has a lot of impact on the psychosocial aspects of the human being. The social networks and the initiatives that come around that are key to succeeding. And as we've seen in some countries, these new initiatives come about in different types of social solidarity. The picture behind is from the balconies in Spain, where every day at 8 p.m. all the people go out to the balcony to sing the song of the pandemic, and then they clap to the first responders, because they are able to, as a community, to create this culture of solidarity towards the fighting of this pandemic. And on a final word, I think it's important to emphasize that the emergency and the emergency response doesn't start when the crisis hits. The emergency response has to start way before. So when looking at recovery, we are looking at this cycle, and all these elements that we see as key elements for the success in fighting the pandemic, the COVID-19 programming, have to be embedded in any type of recovery program we plan for all the effects of the pandemic, for the sake, as part of the disaster risk reduction, for the sake of avoiding and building the capacity from below for avoiding the next crisis. Otherwise, we'll just head to the next crisis. So within that framework, we would like to see the case study of Greece, of the program that we have in Greece that is led by Sarah, that is working together with refugees in Greece, both in camp setting and in the urban setting. To you, Sarah.
Thanks, Alma. So can I, yes. One second. So hi everyone, I'm Sarah. I'm the country director for IsraAid in Greece. I'm actually speaking to you from the UK, but I'm still managing our response over there from here. And I'm going to talk to you about our the response that we're implementing in the 2 missions that we run there, and how important the community is in that response. So we actually, IsraAid is operating 2 missions in Greece. Can you see, are you over the text or can you see the full screen? No, okay, I'm moving it over the side.
We see the screen.
We see the screen. We see the screen.
So we're our focus in Greece for a long time has been on integration, and as Nama said, everything that we're doing in a way is preparing for a crisis to come. The situation in Greece is an ongoing crisis, but the work that we do to try to support people to build their lives there, to learn the language, to integrate with the host community, means that they are actually better prepared in the situation that we now find ourselves in. So the work that we've been doing is primarily on education and protection within the refugee community, and we're doing that in 2 locations. So one is on Lesbos, where we run a school for Afghan refugee children next to Moria camp. Our team of refugee staff are teaching core subjects like English, maths and Greek, and we're also offering psychosocial support activities there. In northern Greece, we have a community center. There's a community of approximately 500 refugees living in the town of Sindos near Saloniki, and it's staffed again by a team of refugee and Greek staff, and again we're operating an education and protection program there. So obviously both of these programs are in very physical spaces. They're based in a school, based in a community center, and when the government closed all of the educational facilities on the 10th of March, our base for operating was no longer available to us, and of course our focus also changed. So while we wanted to keep delivering our interventions in some form, obviously a new priority was prevention and risk reduction, ensuring the health and safety of our community, as well as helping them to contribute to the wider health and safety of the Greek community. So how did we do this? In terms of preparedness, as was said, really a part of this is the existence and the strengthening of the community itself. So we're really lucky that we have a community that was built around the center in northern Greece, but we also have a community of parents for the children in the school. And many of the really important mechanisms were already there. So we have community mobilizers and community coordinators, we have communication channels, and we have ways to keep the community connected and empowered. So the preparation phase has both been very long, but actually also in the last month or so, very, very short. I think everyone experienced how quickly the lockdown was implemented, especially in Greece. So we were trying to disseminate guidance and information as much as possible. Our mobilizers were working to really communicate urgent updates in a way that was really easily understandable. And we were also lucky in that just literally the day before the lockdown was enforced, we were also able to do distribution physically of materials and packs that could be used as part of our education and protection programs. In terms of the response, which is still ongoing, a really key part of this is the continued provision of accurate information. So in Greece, the lockdown is quite serious. For example, every time you leave the house, you need to send an SMS explaining why, with the exact reason why you're going out, or carry with you a piece of paper that must be in English or Greek explaining, again, the reasons. And if you are caught without this and without an ID, you're given a fine on the spot. And obviously for a community that's anyway relatively isolated without access to information often in their own language, this is a really important thing to know. So things like that have been really important for us to use our community platforms and community coordinators to share. So it's also, we're using the various platforms that we have also as a two-way communication channel. So for example, the fake news, like Nama mentioned, is coming up occasionally, and we're able to respond to that and share accurate information. And we're also, as well as the important health guidance and government guidance, we've been able to continue delivering our educational tools and activities, as well as our PSS interventions online, because it's also really important that we mitigate other issues. So we want to reduce the impact of this on education for children and adults, but also reduce the huge impact that this could have in terms of mental health and well-being. I think we're all very aware that this is an underlying time bomb that we want to try to reduce the impact of as much as we can. And in terms of recovery, this is a bit of an unknown for us in terms of its specifics at the moment, obviously. Everything will be different country to country, but again, the responsibility of the individuals as part of the community will remain the same. It will be really important that the community adheres to whatever steps are going to be introduced, and that the community also has a role to play in whatever form that we end up reopening or restructuring our programs, and they will play a key role in how we move forward after this. So as how we've been able to deliver this response, we, like everyone else, have moved online. What was really important to us was that we use the channels that are already existing, that are already in use within our community, that are easily accessible, and that people are familiar with. So we already had a Facebook and Instagram page in our Northern Greece mission. Almost all of our classes, parental groups, PSS sessions had also WhatsApp groups within them, and also larger WhatsApp groups based on language, where we sort of shared updates and information about the centre. So we had a great setting off point to start from. In Lesbos, most of the parents are using Telegram, so we were able to create a channel there where they can access the information from us easily. The only new platform that we set up was a YouTube channel, but this is really a place where we've just been able to store content that we then share across the other channels. So our community physical presence in the two missions just moved or focused its attention now in our online channels. And to talk a little bit about what we're actually doing. So obviously, I said a key part of this, or our priority really, is the sharing of information, because this is how we're ensuring our responsibility in terms of health and safety and protection for the community. So we're sharing information as we receive it in all of our channels, in Telegram and WhatsApp. Our community mobilizers are also taking some of the information which sometimes can come through in a more complex way from the government into more easy to understand and digestible formats. So you see in the center the cards that we made in 5 different languages, explaining what does social distancing mean in a supermarket, what do you need to do in a pharmacy, in retail stores. So it's clear and available to everyone. And we've also been translating some WHO guidance, again in a way that is more easy for our community members to understand. In terms of keeping our education programs going, education and protection are really closely interlinked. And especially now, while one of the objectives is to minimize disruption to education, especially for children, it's also a way of ensuring people are keeping busy, are keeping motivated and engaged. So we are doing online classes in Greek and English. We're sharing videos, we're doing Google quizzes, we're sharing homework exercises that the children then send their responses back. And in terms of protection, one of our main goals here is to keep a connection between all of the different community groups that we have, and to check in with people, and also again provide interventions that can occupy and fill time. So with our under 5s, we do parental check-ins once a week. We check in with each of the families. We shared activity packs before the lockdown. So we're sharing like a arts and crafts tutorial. We do a workout session, bedtime stories, this kind of thing. We're also sharing relaxation techniques, cooking tutorials, various things like this, and even our art therapy program, which is very, physical and usually involves being in the space. We've also had 2 of our sessions move online. So the community structures that we already had, and the strength of the communities that we work in, really enabled us to deliver this, and it's also a sustainable approach. We can now keep doing this for a significant amount of time, something that if we'd had to start from scratch with trying to set up a community or build these mechanisms would have been almost impossible. So yes, it's been crucial that we've had this space and structure to work from. That's it from me.
Thank you, Sarah. Questions I see that Tatiana asked earlier, and I know that sorry, you referred to it, but I'm not sure. Let us know, Tatiana, whether it is what you asked. She was asking, how do you run online psychosocial support? So if you could elaborate a bit more on this, it would be great.
So we had a lot of discussions, firstly about all of the already covered.
Okay.
I could say more if you want.
It is important to mention that the PSS, the shifting the PSS to online was one of our biggest concerns, and the protection issue in general is obviously cases or people with protection issues from beforehand probably are even more so exposed, obviously depending on the case. And it's really required a lot of internal and specialized consultation to figure out how to, on the one hand, shift it to a distant mechanism platform, while in staying having it be continuously responsible, because there's a lot of risk with offering PSS in this distance, and at the same time not cutting it off. So right. I think that one of the modules that was shared by Sarah here was a call center. So it's not really a therapeutic, and we also don't do therapy in that sense in general. It's a psychosocial support. We continue the connection. We have alert systems, but we don't, for example, reach out to members that we have no information about the context they live in, etc.
Okay. And actually, I have a question, if it's okay with you. I have something. Well, I'm not sure it's the directly from. Actually, yes, it is related to the COVID-19. You referred earlier to the population. I'm using the word population that you work with as a community. Now, from what I know, yes, I see you smiling now. It's a question, right? Because from what I know, especially in Moria, my experience in Moria, and maybe this is the opportunity to share with the others what is Moria about, because I'm not sure it's well known to all of us. It's full of fractions, right? So it's not one. I think, I don't know. You're there in the field much more when I've been there last year. It's not one big happy community, right? So how do you work with a structure that is not the pure sense of community? If we are looking on different groups within the camp, how do you deal with the challenges that are arising from the conflict between themselves? I don't know, questions or challenges related to cultural issues. So to say you work with communities is great, but for me it's a question how you manage to work with in such a context. If you can, I'll be really happy to learn.
So I guess the community that I'm referring to specifically is the community that we have around the school that we operate. So we're working with Afghan refugee children, and so we're connected with all of the parents, and they're the ones that we've been working with. However, we also have a team of refugee teaching staff who live within the camp, and throughout this process, in Moria, it's very difficult because of the communication issue. You know, that there's not readily available Wi-Fi everywhere, and data, especially with the restrictions on movement, is difficult to come by, which is why we're using a different platforms to elsewhere. But everything that we are able to disseminate and the information we're able to share is still then able to be spread by these sort of community leaders or coordinators further within the camp. And actually, within both missions, the benefit that we all know of going online is we're actually now reaching a much wider community. So the parents of our children are now sharing the content and the information that we're delivering them, to other parents who are now subscribing to the channel on Telegram. So the community that we work with is actually expanding.
The
community.
Yes.
But I think it's a great question that is relevant, obviously, for any situation, not only here. And it's the question of what is the community, who defines the community. Community is obviously a huge buzzword this day, especially when the social networks come into play. And I think it's even more so of a question when talking about forced migration and communities on the move. These were the first questions I had to ask myself when starting to work in refugee camp. Who is the community? Is it the community of a region? Is it the neighborhood? And I think that the message that is important for us, at least here, is to ask the people, who is the community? Yeah. And the situation of refugee camps in particular is even more so interesting for this, because who would imagine that social distancing would be an issue for us as sitting in our houses, at least for me sitting in my house. Who would imagine that the practice of social distancing will be the challenge? Because in refugee settings, one, in terms of the setting and the housing and the tents and how people live, and also in terms of getting essential services, there is no avoiding standing in line with many other people for getting the water or the food ratio, etc. And with that, for me, I think is even more interesting how the responsibility of the community in controlling this even comes about more evidently, especially in the sense that since the social distancing is unavailable, I would say, how do we leverage on that and utilize the proximity that people have for the sake of implementing these kind of programs, and where in that sense any type of community control mechanisms, you are very right. I think that, at least for us, one of the biggest concerns alongside with the psychosocial aspect is the security aspect. As soon as they say that movement will be restricted, all of a sudden we saw in many countries movement restrictions between specific hours, which congested the supermarkets because everybody got very much afraid not to have access to essential items. And therefore, in these situations, having the refugee teachers within the community, where basically, putting a loudspeaker with the right messaging actually reaches a much wider scope of the population than what it would reach me. I don't know, at least for me, I didn't have the band come to my street to give me some entertainment. So in that specific setting, and Sarah didn't show, but in the school, all these different communities and the different regions of people are all represented in the schools, and the communication and the messaging comes from the people, from the community, with the community structure that they have, to the other members. So between the integration and having the school within the language of origin, that's it's a hybrid that kind of, mixes a little bit even more the complex question of what is community, but it's a community and school. That's no doubt about that.
Oh wow, okay. Actually, it's in some certain extent it's more of it's not only agents, it can be also it's leaders, right? It's taking the agents can become and maybe should become leaders of the message, if I understand
Yes,
you right.
Exactly. And what's even in terms of this response, what we see is, as we said before, in other situations, maybe we would enhance capacities of systems, of governments, of the communities by bringing about outsiders, deploying additional staff. In here, what we see that the increased capacity of all these systems are basically bottom up. All these systems are growing from the bottom up. We see in Israel, at least, medical students are leading a lot of the medical response. So it's really the entire system is building itself and its capacity, but always bottom up, which for me is very interesting in how this response is being managed.
Okay. At the personal level, of course, I have many questions, but it's not for now. We need to call it off. So, guys, anyone else has some questions, some comments, insights? If not, and if something comes up to your mind, you can email one of us or ask one of the partners, and I'm sure that Naama and Sarah will be happy to answer, especially now when they have nothing to do in their confinement. No, I'm joking. Thank you, both Naama and Sarah, for your for sharing with us your insights and experience. And I'm saying again, guys, this lecture is recorded, and we will send it around tomorrow. So you are more than encouraged to send it all over. And our next lecture will be on next Monday, on the 13th. It will be a lecture given by Boya, and this is also will be sent over through the social media. That's it. If no one has something else to add, it was a pleasure again to have you all here with us.
Thank you so much for having us.
Thank you.
Bye-bye.
Bye. Thanks. Bye-bye.
Bye.
Bye.